All right, so this may shock some of you guys, but we have yet again another story of Big Pharma completely ripping off the American people, as Merck, the company that also happens to make ivermectin, has now come out with a new pill that supposedly reduces the chance of, if you have COVID, you ending up in the hospital. So it's a little bit of good news, bad news here, because it's fantastic that we would get an actual drug that's not a shot that you have to get in your arm. It's easily digestible, right? You just take a simple pill, and then apparently, according to preliminary data, which we have not gotten any FDA emergency use authorization or anything like that yet, but apparently this pill, and we're going to read some of the details here, is pretty good. So this would be fantastic if we got this pill. Unfortunately, tied hand in hand with that, living in the United States means that some big pharma executives have to walk out the back door with billions of dollars in profits, and it seems like that's exactly what is going to happen with this new COVID pill, as has happened with the rest of the vaccine. So Merck sells federally financed COVID pill to the US for 40 times what it costs to make. Hold on, let me just read that again. Merck, a private company, sells a federally financed COVID pill to the US, okay? That same federally financed source, the US, for 40 times what it costs, okay? So we are investing millions of dollars up front to help with the research and development of this drug, and then they are going to rip us off on the back end. So this is just, classic America, but nonetheless completely ridiculous. So let's get into some of the details here. A 5-day course of, and I'm gonna butcher this name, but it's really hard to pronounce, molnupiravir, the new medicine, being hailed as a huge advance in the treatment of COVID-19, costs $17.74 to produce, according to a report issued last week by drug pricing experts at the Harvard School of Public Health and King's College Hospital in London. And Merck is charging the US government $712 for the same amount of medicine, or 40 times the price, okay? $17 to manufacture, roughly $18 to manufacture, $712 is what they are charging us. Why? Who the fuck knows? It's just entirely arbitrary. It's how much money can we possibly stuff into our pockets while running out the back door with all of that money, and not have the federal government come cracking down on us, which they should be doing, but there's no evidence so far that they will. But let's continue here. So last Friday's announcement that the new medicine cut the risk of hospitalization among clinical trial patients with moderate or mild illness in half, okay? So if you get COVID, you're showing some degree of symptoms, it could possibly reduce the chance of you ending up in the hospital by half, okay? So that's pretty substantial. If we could cut down our hospitalization rates in half, that would be absolutely massive. But cut it in half could have huge implications for the course of the coronavirus pandemic, and because it's a pill as opposed to monoclonal antibodies, a comparable antiviral treatment that is administered intravenously, molnupiravir is expected to be more widely used and hopefully will cut the death rate. And in the first 29 days of the trial, no deaths were reported among the 385 patients who received the drug, while 8 of the people who received the placebo died. Very unfortunate, according to a statement put out by Merck and Ridgeback Biotherapeutics, the two companies that are jointly launching it. So again, very preliminary data here, but pretty promising if it is accurate and it's actually legitimate, because again, that would be absolutely massive. One of the biggest problems we have right now is we are running out of hospital space because there are so many unvaccinated people in the hospital. So if we could speed up this process and get this drug out to people as they are getting COVID and starting to experience symptoms, that would be a pretty massive thing. Unfortunately, again, they're trying to price gouge us for this medicine, so obviously is going to be reducing the amount of people that are going to be able to have access to it if you're going to be charging $700 goddamn dollars instead of like 17 or 20 bucks. But they continue here saying that, like the vast majority of medicines on the market, molnupiravir, which was originally investigated as a possible treatment for Venezuelan equine encephalitis, was developed using government funds, and the Defense Threat Reduction Agency, a division of the Department of Defense, provided more than $10 million of funding in 2013 and 2015 to Emory University here in Georgia, as research done by the nonprofit Knowledge Ecology International has revealed. And the National Institute of Allergy and Infectious Diseases, part of the National Institutes of Health, also provided Emory with more than $19 million in additional grants. So we're looking at roughly $29 million that was given by the government to finance some of this research. And yet, only Merck and Ridgeback will reap the profits from the new antiviral, which according to courts could bring in as much as $7 billion by the end of this year. $7 billion by the end of this year for a goddamn COVID treatment. Okay, completely ridiculous, but the only reason this $7 billion number exists is because they are upcharging us $712 for the treatment. So they are, again, walking out the back door with billions of dollars at the expense of the entire country, and really at the expense of the entire world, although we as Americans are going to be getting ripped off significantly more than many other countries around the world because our federal government does not have the ability to negotiate good contracts with these companies. But they continue saying that After the announcement, they continued saying, after the announcement of the encouraging clinical trial results on Friday, Merck's stock price climbed while the stocks of some of the other vaccine makers sagged, which this is in and of itself completely ridiculous. Why do we have stocks for fucking vaccine manufacturers? We should not be having a profit incentive in the big pharmaceutical industry in any way, shape, or form. We should be nationalizing this shit. Again, the lesson is, if we're going to invest millions of dollars up front to develop this, why are we letting them price gouge the American people for American taxpayer-funded treatments and cures for this? It's completely absurd and ridiculous. And despite its initial investment, the US government seems to be facing a steep markup in prices, and in June, the government signed a $1.2 billion contract with Merck to supply 1.7 million courses of the medication at the $712 price, and the transaction is due to take place as soon as they receive emergency use authorization from the FDA. And listen, I mean, this is completely ridiculous, right? We're going to be entering in to this contract period with Merck, and if we had any sense about us, then we would be demanding, not asking them, not begging them for a lower price. The federal government would be stepping into this process and using what we're about to describe right here, which is an actual solution for what they could be doing to this. So the pricing differential should be grounds to demand a better price under the Bayh-Dole Act, according to the Knowledge Ecology International's Abinator. And this act, passed in 1980, regulates the transfer of federally funded inventions into commercial property and allows the government to march in and suspend the use of patents that were developed with government funding if it determines that the products are excessively overpriced. Seems like this would be the exact situation that you would use this act to actually do that. And they say, quote, the pressure for march-in rights around this drug is going to be huge, predicted Abinator, who suggested that the government could use the law to lower the price of this drug. And when the Biden administration negotiates another supply agreement with Merck, they should probably leverage those rights in order to get a better price. And according to Gotham, who's based in London, the short supply of this drug already sums up the best and the worst of the U.S. pharmaceutical system. Quote, it's a great coup that the American government funded some scientists to develop antivirals, he said. The great tragedy is that after their great success, they just gave it away to private industry with no strings attached. And this is just a tiny picture of what the entire American pharmaceutical industry looks like. We just had this recent report come out from Public Citizen. Report: for 20 top-selling drugs, Big Pharma made far more from U.S. sales than from the rest of the world combined. Okay, this is the degree to which Americans are getting price gouged for pharmaceuticals that, again, we are in large part funding through the NIH and through its various subdivisions, right? So this is the situation we have right now in the United States. And I've been talking about this exact same dynamic about the COVID vaccines, right? Lots of people like to come up with conspiracies surrounding the COVID vaccines. Oh, they don't work. Oh, there's going to be a fucking microchip injected in your veins, whatever the case may be. Or you have examples like ivermectin, which was another great example of a conspiracy surrounding these surrounding big pharma. And what people do is they take good skepticism, a healthy skepticism of the pharmaceutical industry, which everybody should have. If you watch my channel, you would know that I have a healthy skepticism of big pharma, right? These people are price gouging us at every turn because they have a profit incentive. That is their only incentive, is to, and we know this also according to the statistics, that their only incentive is to give money to shareholders. Their only incentive is to give money to their executives and their CEOs, right? And we know, according to the data, that these big pharma companies on average are spending way more on marketing, on executive bonuses, on stock buybacks to drive up their stock prices than they are on research and development. So there's absolutely no argument to continue maintaining a drug pricing system like this. We, one, need to be passing in this $3.5 trillion bill, we need to be passing this drug pricing reform that would allow Medicare to negotiate all of our drug prices on behalf of the American people, because then you have 330 million people to use as leverage to say, no, you're not going to price gouge us. If you want to have access to the US market, you have to give us fair prices for it. So that's step one. But beyond that, we should be entirely nationalizing our pharmaceutical development industry, because, again, listen to the dynamic that is happening right now. This is the dynamic that is the case throughout the entire pharmaceutical industry here in the United States. We fund, through the NIH, various subdivisions, we fund these drugs to be created. Then these big pharma executives, they aren't the ones innovating, okay? Scientists are the ones who are innovating. These big pharma companies and corporations, they just buy the innovations and then price gouge the American people for access to those innovations. So it's completely ridiculous, completely inefficient, and we need to be completely nationalizing our pharmaceutical industry here. And this situation here with them charging 40 times the price is just a fucking slap in the face. We are in the middle of a goddamn pandemic, and the company that is producing this pill that could potentially save countless lives, right, is trying to price gouge us on the way out. And so again, there is a good, healthy skepticism to have of big pharma, and this is really where the skepticism should lie. If you're going to have a conspiracy surrounding the vaccines or surrounding COVID cures, it should be that all of these gigantic pharmaceutical companies are profiting billions billions and billions of dollars from this life-saving medicine instead of letting the entire world have access to them. That is the actual COVID cure or COVID vaccine conspiracy that has been happening. It's not that ivermectin is some miracle cure that their big pharma is trying to hide from you. And again, this is evidence because Merck is the same company that produces ivermectin. So they're turning around and actually producing something that is supposed to be used for COVID, which ivermectin is not supposed to be used to treat COVID, according to Merck. But they have this new pill, and they're trying to do the exact same thing that all of these other vaccine manufacturers have been doing. So listen, the conspiracies are out in the open, okay? If you want a conspiracy around the vaccines or around these COVID cures, it's not because they don't work. They do work, okay? The treatments do work. All of the data is very clear about that. The actual conspiracy is just fucking capitalism, okay? It's just out in the open capitalism. It is the privatization, the for-profit model of big pharma, okay? And that's the dynamic that we absolutely have to change.